ReBUILD is a health systems research programme consortium, and it's the first one that DFID has funded that focuses on fragile and conflict affected states, which are a really neglected area, although there's a lot of discussion of the importance of them and the fact that the worst problems of poverty are in fragile and conflict affected states, and that if we are going to tackle those, we have to focus on the specific issues of fragile and conflict affected states. In fact, in part because they're very difficult to work in for a range of reasons. There's been much less work in those than in others. So we set out to tackle that rather difficult problem of filling that gap. We have a programme of work that builds on the evidence from each country that we're working with, and we also have affiliates who work in a wider range of conflict affected countries. And then we have another programme of work that's focused on trying to use that evidence in the world more generally, and that involves all partners in the same way that the research itself involves all partners, and the governance involves all partners. And it's important that we think about the chain of understandings and evidence from the local level through to the global level. So there are many, many issues to be considered. The partners in the programme are Queen Margaret University in Edinburgh, the Liverpool School of Tropical Medicine, the College of Medical and Allied Health Sciences in Sierra Leone, Makerere University in Uganda, and the Cambodian Development Resources Institute, and the Biomedical Research and Training Institute in Harare. What happens in that immediate post-conflict period is critically important for how the health system will develop thereafter, and that mistakes made there will be paid for a long time to come, and that getting things right at that period will reap benefits for a long time to come. And that involves thinking about the chain of events and how chains of events in the past shape chains of possibility in the future. So that means that we've taken a historical approach, I think is a distinctive approach that we've taken within the programme compared to other health systems research. And the critical method that we've used to try and take a historical approach, given the difficulties of accessing historical data in conflict-affected states, is life histories approach. So we have been gathering data from health workers and from users of health systems about their whole life stories of involvement in the health system. One of the things that we would talk about as the main outputs of the programme to date is a set of understandings about what the differences between post-conflict health systems and other health systems are. So these include issues of the ways health systems have been directly affected by conflict, destroyed infrastructure, health workers who have avoided conflict areas and the maldistributions that result from that. But also indirect effects of the conflict, and in particular the global response or the international response to the end of the conflict, which often involves very particular constellations of aid actors and particular difficulties of managing health sectors in those circumstances. A critical factor in a post-conflict health system is that with inexperienced junior staff sitting in senior roles, negotiating with multiple international actors who are often senior and articulate and not always as sensitive as they should be to the need to understand local context, that local voice is extremely important. And local voice is extremely important just as it's weakest. So I think one of the things that we are doing, and I think we've almost stumbled across the importance of this, is strengthening that local voice, because it's not just any local voice, it's a local voice that understands the issues of the relationship between things like the trust between the population and the government, things like the real implications of a public health measure for people in their households, and can get across how not only that matters for the sake of the people in their households and their well-being, but for the effectiveness of mechanisms that people are trying to put in place to improve health system functioning. The difference between this RPC and others is that the principal target for our policy impact is at the global level rather than at the individual country level. You know, almost by definition, not quite, but almost by definition, being post-conflict is a transient state. And we're trying to look at what countries going through that transient state can offer learning to countries that are yet to go through it. So our targets are really trying to get the international agendas to recognise the importance and the distinctiveness of post-conflict agendas. I think partly the outcome of the programme is to better understand what the critical research questions are, and I think we can identify some. So I think one thing that looms really large is the issues of trust in the health system. To the extent that the health system is a government body or a government institution, issues of the relationships between government and population are obviously at the core of every conflict. And it isn't that as soon as the conflict is finished, the population forgets everything that's gone before. Those issues remain important.